And I was really proud of her and her mother for coming to the decision to get vaccinated. We know being vaccinated matters. So patients who are fully vaccinated and boosted are less likely to get COVID, and they're 20 times less likely to die. And in the communities where I work, that's really important because we've been disproportionately impacted by COVID. Additionally, if you're fully vaccinated and boosted, if you do get infected, we know that you're less likely to have symptoms. And many of my patients have had no symptoms at all. And that really brings us to the second piece, the second tool in our toolkit, which is testing. So we are likely all going to be exposed as cases rise in the district. And so testing is a way to keep your family and your community safe. And DC Health has offered tons of options for testing. Our patients have been using the walk-up testing centers. They've been getting testing kits at the libraries, at the pickup and drop-off sites. They get tested at their healthcare provider. Unity operates 5 respiratory evaluation clinics as well. So your healthcare provider is also an option. I'm really excited that the district is investing in more permanent options in our communities to get testing so that we can all be safe. It's also really important just to note that we shouldn't be going to the emergency room just for a test with all these options out there. The emergency rooms are being overrun with cases, and we need those doctors to be able to take care of the patients who are sick. Not only do we have COVID out there, but we have our other conditions that plague us. So keeping the emergency rooms for emergency care is really important. So if you are sick, please stay home. That's really important. And monitor yourself for symptoms. If you're starting to get trouble breathing, chest tightness and fullness, maybe difficult to stay awake or falling asleep a lot, some confusion, those are signs to go to the emergency room. But otherwise, a lot of COVID can be taken care of at home. And just really to wrap up, I want to say, again, thank you to the mayor for hosting this event. Getting vaccinated and boosted is the most important thing that you can do. Testing is also really important. But the other things we've done, wearing masks, washing our hands, and staying home when we're sick, are all crucial elements to fighting the pandemic. So please, this is a life-saving message. We know that vaccines save lives. Please share it with your friends and your loved ones and your neighbors. I know in the community where I work, this is critical. So thank you. And if you need support, please reach out to a healthcare provider. If you don't have a healthcare provider, a community health center will always welcome you. So thank you. And now it is my great pleasure to introduce Mayor Bowser.
Thank you, Dr. Boyd. I hope everyone heard Dr. Boyd loud and clear, and congratulations to you on your appointment as the president and CEO at Unity. Unity, of course, is a fantastic partner to us in D.C. Throughout this pandemic and with providing everyday health care. It is especially good to hear the comments of a pediatrician who is serving our smallest D.C. residents and hearing the types of questions that they have. I want to welcome you to one of our community centers. This is going to be the Ward 7 COVID center where you can get vaccinated and tested. We're right in the shopping center. We wanted to be conveniently located in a retail space near the Safeway and the library. And so we know we wanted to continue our very strong testing program. We know we have the strongest testing program in the nation. We have free rapid tests in every ward, walk-up PCR test as well, and at-home testing for our children. Testing in our schools, we know, along with all of the other available tests, will help us keep critical services going. So we said from the beginning, if you need a test, you can get a test. And we are going to be having centers like this across the district that will make sure that residents know exactly where they can go in their own communities in a more permanent facility that is going to be supported by DC Health. We're entering, sadly, 3 years now, our third calendar year for our fight against COVID. And we know that it's going to be a part of our lives for the foreseeable future. So we have recognized that we have to adapt to these realities and stay ahead of the curve. So I want to reiterate what the doctor has already said, that the way that we will maintain critical functions in our community, keep our schools open, keep our family and friends together, all of our team members and the government and the things that we are accustomed to doing. We have to be sure to get tested when we need to be tested, to get vaccinated. And those are the ways back to a more normal life. So I want to again thank Dr. Boyd for highlighting the importance of vaccination, getting vaccinated and boosted, wearing our masks, and getting tested as all a part of a critical layered mitigation strategy against COVID. So with that, I'm going to ask Patrick Ashley to join me at the podium for a quick DC health update and to say a little bit more about the COVID centers.
Good morning. Thank you, Madam Mayor. So today I want to talk a little bit more about what's happening here at the COVID centers and our investment in making sure COVID testing and COVID vaccines are available in the community. So today at 1 o'clock, we will open COVID centers in wards 1, 2, and 7, and 8. These centers are centers that are in well-known locations throughout the community. What we've tried to do since the beginning of COVID is make sure that we place COVID resources in places that are accessible and known to the community. And so you'll see that at our libraries, you'll see that at our firehouses, and now with these COVID centers, is these represent permanent structures in the community that allow you to get access to testing and vaccine. So what we've done with these centers is made sure that they're open. We'll have centers that are open 7 days a week. These centers, each center is going to be open 6 days a week, but we'll always have a center that is open. We've also made sure the hours for these centers are available to individuals that may not be able to come during the day. And so we have centers that are open as late as 9 p.m. All of our hours are later hours so that we make sure people have access to our testing and vaccine resources. Nothing in the community right now is going away. So we still have access to library testing. We still have access to firehouse testing. We still have our pop-ups throughout the clinics. We also have our vaccination opportunities available through the clinics. That's in addition to the 150 locations throughout the community you can already get vaccinated. So what can you expect here at a COVID center? You'll be greeted by professional DC health staff that are available to help you get vaccinated, boosted, any of the varieties of products, whether that's Johnson & Johnson, Moderna, or Pfizer. You can come and get your first dose, your second dose, or your booster. No questions asked. You can come here, and we want you to get vaccinated. So if you haven't yet had your first vaccine or you're behind getting your second vaccine, that's okay. Come and see us. We'll also have access to rapid antigen kits here. So this is in addition to our 9 library locations that we have currently. You'll be able to come and pick up additional rapid antigen kits here. We'll also have a PCR testing kiosk, and so that's where you're able to complete a test while you're here and drop that off, similar to the same sort of test that you would get done at a firehouse or one of our pop-up locations throughout the community. Again, we'll keep the test yourself at home. We'll keep those at the library, so you'll still pick those up at the local libraries, but we'll offer PCR testing here as well as antigen pickups. So just a reminder, the importance of getting boosted. We talked about the importance of getting vaccinated, but also the importance of getting boosted. The CDC recently changed the guidelines that said for individuals that had Moderna or Pfizer, you can now get boosted after 5 months instead of 6 months. And so just a reminder to everyone listening to make sure that we're open and available for boosters. Starting next week, we will have additional sites to announce, and those are in the remaining wards of 3, 4, 5, and 6. And so we'll have more details on when those centers will open up throughout the community. With that, I'll turn it back over to the mayor.
Thank you. So we'll take a few questions and then have you escorted to see the different stations in the COVID center. Yes, Sam.
Your mayor, does this mean that you're closing down other centers? I know you got firehouses and stuff like that. Is it?
Well, Patrick addressed that. So we will continue to have at-home tests available at our libraries, and fire stations will continue to offer PCR tests.
So there'll be no change there. All the current places will stay open, and this is just in addition to.
Well, presently, the big thing to focus on is the vaccination, and the vaccinations will happen here, supported by DC health staff. Yes.
Mayor, Terry Pickett with the Washington Times. Now, last month you implemented this whole vaccine passport policy for restaurants and bars, but without similar rules elsewhere in the D.C. region, including Northern Virginia, where you're going to have not just residents here in the district, but also people who commute in, as well as tourists. They're just going to go over into Northern Virginia to do what they have to do without having to need the vax cards. How are you going to avoid lost revenue in this respect?
Well, we know that there are many residents who like to have a safer environment to go to the restaurant and to do all of those things. And we know that we have a very high vaccination rate in the region. And so we're simply asking people to show their cards, and then they will take advantage of all that we have to offer, which is different than many other places. Excuse me. Go ahead.
No, but I just want to still, though. I mean, people are just going to go into Northern
Some people will,
Virginia.
and some people have. Some people have because they don't want to wear a mask, for example, because they don't have similar rules. We have a different set of rules in the district, and we invite people to continue to take advantage of them. Next question.
About these clinics here or these centers, if you're someone who just wants a rapid test done, could a staff here assist someone in getting that test done? Because it can be maybe burdensome for someone. I don't know.
Sure. Let me ask Patrick to address that.
Thank you for the question. So certainly we have staff that are here, professional nurses that are available to assist individuals to get tested. Ideally, the antigen tests are to be done at home, but we're certainly happy to show individuals because we recognize that not everyone has done this before. And so we're happy to show them how to do one and then with hopes that they take them home in the future.
Yes.
Speaking of the vaccine passport requirement and having these extra centers opened up, have you seen since making the announcement of that places that are already offering people vaccination have been filling up? Is there the need for these extra ones? Maybe with people
we're
having
just
to wait.
opening today, and one thing that we wanted to address is people knowing exactly where they are. Right now, we have been operating the vaccine clinics that the district supports. One day it's this location, the next day it's someplace else. So we want to have a more permanent location for people to go to for vaccination.
You open up these for more so people know where to go every day rather than say the demand increasing so much that you needed the extra.
I would say that's correct. Yes, Mark.
Just some clarifications on these locations.
Sure.
Will everything be limited? Will anything be limited just D.C. residents? Patrick had said no questions asked. I think that he was talking about the shots.
Yes.
But will the rapid test still be limited here? Yes.
That's correct.
And then when people come here for a PCR test, is that they swab themselves and then drop it off?
We have, and you'll see when you go on the tour, you'll be able to see some locations that we set up where people could go in, put their things down, do their test. And I think that's the only PCR test that we offer here. Yes.
Okay.
So it's a test yourself.
Okay. And it's the
And
same.
you can drop it here, and it'll be picked up here and go on to
and
be
it's the
analyzed.
same website to register that you would do the library test, drop off, self PCR test.
Let me ask D.C. Health to. You're asking me some details I'm not familiar with.
You have there are right now 3 different websites. Depending on where you get tested, you have to register at a completely different website.
Yeah, thanks, Mark. It's just like going to one of our firehouse locations or going to one of our pop-ups throughout the community. It is not the self-test that you would use as part of the library. Instead, it's coronavirus.dc.gov/register. Some people know that as securelink.dc.gov, depending on how long you've been testing with us. And so it would just be that same link that you use if you were to go to a firehouse.
While I have you, I'm wondering, one, we saw last week, the last day that you reported numbers, there were 10 deaths on Thursday. Can you tell us, and will you start reporting whether deaths are those of people who were vaccinated or not vaccinated? And can you tell us that of those 10 people?
Yeah, of those 10 individuals, they were either unvaccinated or an unknown vaccine status. And so that either means that we can't find record of their vaccination status, or we're still investigating that case. And so we will provide more information in the coming days to weeks about some of what we're seeing in the community.
So you will be starting to provide that data when you provide the number of deaths per day, whether or not they were
We
vaccinated?
won't be providing that daily. We'll be providing more data in the future about what we're seeing in the community, who's being affected by COVID. We'll provide that at a future update.
And do you know, have you seen, we probably won't get the numbers released till later today, but have you seen the numbers since Friday, Saturday, Sunday, Monday of the deaths? Was that a one-time anomaly, or have you seen a trend in deaths going up in the past 4 days?
Yeah, Mark, it's a great question. So we see the data almost at the same exact time the media sees the data. So I have not yet seen the weekend data yet.
Thank you.
Who hasn't had a chance to answer a question? Right here.
When it comes to the vaccination card requirement, what have you seen so far in the first couple of days? How is it working for businesses? Have they seen any pushback, or are you getting positive feedback so far about that?
I don't think that I have a lot to say about that yet. I will say that our teams have been out to see if our establishments have any questions, or we can offer any support, or to see if we need to encourage them to make sure they're enforcing the rules. So I don't have anything to summarize more than that.
Have you heard from any jurisdictions in the area who are seeking advice from you on how to do this? I know Montgomery County has talked about instituting the same requirement.
We understand that Montgomery County has looked to our order, and that's what I know about it at this time.
You haven't been in touch with them yet, or they haven't reached out to you for?
There have been staff-to-staff discussions, as I understand it. Sure.
What exactly is the enforcement mechanism as far as your team is concerned? Are you talking about law enforcement going into these restaurants and bars?
The
I mean,
mayor's order, and we can share it with you so you understand that our alcohol, we've changed the name, ABRA, we call it ABRA, is the enforcement mechanism where there's a liquor license involved.
So do they go bar to bar or restaurant to restaurant exactly to make sure that the staff there is actually asking patrons to
They
show?
have a regular kind of program of supporting our ABC establishments on a variety of enforcement issues, and so that's what they do. Yes.
I just want to understand exactly just the process. Is it sort of I don't say secretive necessarily, but is
No, we have inspectors, and
Right.
the inspectors wear a badge that says they're part of D.C. government. Most of the ABC establishments are familiar with them because they are responsible for enforcement for all manner of issues. And so they go into the establishments to see if they need any support.
So are there also surprise inspections where they come in just to make sure that the staff is actually checking for these vax cards?
I would say that most of the work that the inspectors do is kind of random. I'm sure that there are times when they schedule appointments, but most of them they're kind of walking through during their tour of duty. Yes.
Again, about the vax mandate, has there been any enforcement yet? Have there been any warnings? I know it's a process of 1, 2 verbal
Sure. I
warnings.
understand that one written warning has been issued to an establishment, and I think that the ABRA makes that information available on their website.
And, again, so is police not involved at all in enforcing this mandate? I thought we heard they were ready to sort of, if needed, enforce.
If the police have to be involved, it would be something different.
So they're not involved in enforcing the proof of vaccine mandate?
They are not. If they had to be involved, it would be for some criminal matter. Yes, Mark.
Mayor Bowser, I'm wondering if you could kind of talk about, you know, on one side of you have Virginia, where the governor is relaxing mask mandates and going in a very much different direction than Washington, D.C. The other border, you have Montgomery County, which is considering Next week, they'll vote on whether or not to implement a vax mandate there. Can you talk about a little bit about what you're seeing on two sides of the river here that surrounding D.C. and how it impacts your ability to move forward with keeping residents safe here?
Mark, we have not always had the same COVID protocols or regulations. As you know, we had this discussion a few weeks back when discussing masks. We've had different levels of being open since June. And what we have determined that's best for the district is that we have policies that get more D.C. residents vaccinated. And we have work to do. You've already heard from the doctor this morning, especially with a message to eligible children, 5 to 11. I think nationwide, we're under 20% of those children vaccinated. You heard from the doctor the difference that it makes for kids, and we really, really want to focus on making sure more people get vaccinated. Similarly, we have a lot of adults who haven't had their first shot. While we know that we've done pretty well, especially relative to other places in the country, there are more D.C. residents that need to get vaccinated. Moreover, we've also heard from D.C. Health that people who are boosted have also fared better with Omicron. So if you are eligible, now 5 months after Moderna and Pfizer, you should get boosted. So we know that the mandates have worked. We've seen it in our schools where we had a chunk of people who weren't vaccinated. We instituted a mandate for all school personnel, and now they are. Similarly, we've advanced our government-wide mandate for a vaccine, and we're going to move that up. We've looked at higher risk activities that people have engaged in, where they gather, where they're eating, and mask off. And that is where we have also instituted the mandate for vaccines.
Can I ask you about the vaccine mandate? Last week, your chief of staff said that you were looking at the possibility of expanding it to employees now that the Supreme Court blocked the president's effort to do that. Are you ever any closer to doing that? Have you made a decision on whether or not you're able to legally and whether
I have not.
You haven't? And then how about the pre-K data? Today, pre-K students are back. They should have uploaded yesterday. Do you have any numbers on how many students actually successfully did that?
Yes, over 6,000, which I'm told represents near 100% compliance with our pre-K kids at DCPS. We also made available our website for our public charter schools, parents to add their data. We have less data from them than we do from DC Public Schools, but we're working on that. I understand that the reported positivity is less than 1% of those tests.
So that's a much lower rate than we saw for the older DCPS, and these are all unvaccinated. Any thoughts on why the number is so low, the positivity rate is so low there?
And I have some thoughts. I don't know if DC Health would share them, but I think that parents of unvaccinated kids have been acting differently throughout the pandemic. That would be my guess. Doc, would you agree? Yes.
And then my last question, has the DC Department of Health issued a liability waiver to hospitals that they had been waived? They had asked for. You issued the administrative order allowing them to go on crisis standards of care, but not the waiver of liability.
I did give the deputy mayor, I know that he is exploring anything else that we need around liability protections for our patients and what the hospitals need. And I expect to support in some form what they need.
To issue that, but that hasn't been issued.
I don't believe so.
Do you know, my last, do you know if any hospitals have gone on crisis standards of care yet?
I do not know that.
Does the Department of Health know that?
So, Mark, we're in regular conversations with the department or with the hospitals. Some of them have modified their service, the way that they provide services. None of them are specifically implementing their crisis standards of care as of this point.
Okay, I'll take a few more, and then we're going to take a tour.
Mayor, this anti-COVID vaccine rally this weekend weekend in D.C. How is the city approaching it, and what does it mean?
Sure.
Since there's a now proof of vaccine mandate for restaurants and bars.
We have asked, or actually the police department has been monitoring it for a little over a week. I'll get some update about their preparations soon.
Do you know how many people are expected? I believe the permit was for 20,000 or so.
I'll have MPD give you an update. Yes.
There's a group of teachers who are starting a week of action. I want to read off just what they want so I don't get it, mess up a little. They're demanding greater health and safety measures, including paid COVID-19 leave, KN95 masks for staff and students, more contact tracers, more COVID testing, and some more clear public metrics. But the teachers who are all a part of this are starting today wearing red to school to show that they're in support of this. I'm not sure if you've heard of it or if you
haven't heard of it,
or if you have any reaction to it.
Well, I feel this would be my only reaction, and I don't know what group that you're talking about, so I hesitate to. Okay, that's part of the Washington Teachers Union?
I'm not 100%.
Okay. We negotiate with the president of the Washington Teachers Union. We're very proud of the work that our teachers have done. And we're also very proud of the work that we have done in making our schools safer places for kids. That's all I have to say. And I think parents are very happy as well about the safety protocols, or you wouldn't see the level of compliance with our testing policies and attendance. Yes.
So I've looked at a lot of the numbers, and as Mark was talking about, they seem to be going up. And at the same time, I notice in the national media in particular, they're saying that D.C. has basically has the numbers that have plummeted more than any other place. They were saying, for example, I think they were down 17% in New York, 25% here. Is this true? I mean, are the numbers plummeting here in D.C. at the time deaths are increasing?
Well, you know this well, Sam, that the way unfortunately it works is that when you see higher cases, some weeks later, you see hospitalizations go up, and then sometime after that, you may see deaths go up. So the deaths lag the case rise.
These people, we get the impression generally this Omicron thing is less deadly than Delta or whatever. What are these people, which version are they dying of from? We know?
I don't know if we can say a little bit more about that. This is what we expect. And you're right to ask questions. We've seen, sadly, I think last week, 10 of our residents who succumbed to COVID-19. And we don't ever want to become numb to that. Those are Washingtonians with families and loved ones who are going to miss them. And I get a report from health throughout the week about those Washingtonians. So I just want you to know how much and how sad we are about their loss. And there are they have a variety of backgrounds. And so I don't know that we can say one simple thing, but if we are able to give some summary information about the deaths that we experience, we'll be able to do that.
But I'm asking, is it the Omicron thing, or is it Delta? What's killing people?
Mark, it's a great question. So to the mayor's point, the one common thing that these people are dying from is being unvaccinated, right? That's what the mass majority of these individuals that we're seeing that are dying, whether they're dying at home or they're dying in the hospital, is because they're unvaccinated. What we saw, our most recent data shows that about 70% of our sequencing shows that it's Omicron in the district, and about the other remaining percentage is Delta. We don't have specific data right now for you on the deaths that we're seeing, but just you can make the connections from that.
So you're saying 70% means the number that are dying of
70% of the cases in the community that we see
have it.
that have Omicron. Yep.
So, Dr. Freefall, you said the vast majority. Do you know the breakdown of how many of those 10 people were not vaccinated compared to unknown status?
I do. I just don't have it right in front of me. Yep.
Okay, last question, and then we're going to take a quick tour.
Just to build on that deaths question, death can be a lagging indicator, you've told us. Is this something then you expected, like a peak in a spike in deaths following a surge in cases?
Well, that stands to reason.